The population of interest that I will use for my care management proposal plan will be stroke patients. According to the National Stroke Association, a stroke is a brain attack. A stroke occurs when blood flow to a specific part of the brain is compromised due to an ischemic or hemorrhagic occlusion. When a stroke occurs, that part of the brain is compromised and lacks in oxygen, therefore affecting the neurons within the specific area. A person is affected by the stroke depends on the area of the brain in which the stroke occurs. Every year, nearly 800,000 people experience a new or recurrent stroke, leaving two-thirds with a lasting disability. A stroke is the fifth leading cause of death and is said to occur every 40 seconds, which is unfortunate because research shows up to 80% of strokes will be prevented with lifestyle changes, disease and medication management, and exercises, according to the National Stroke Association. Stroke guidelines by the American Heart Association are broken up into varying groups. First is the pre-hospitalization process. This process entails significant community education regarding the stroke system and when to seek emergency care. A stroke should then be considered a priority call to the 911 dispatcher. The goal is for the patient to reach the hospital emergency from the onset of symptoms in less than 3 hours. Brain imaging is also important with the goal of obtaining images less than 25 minutes upon arrival to the emergency department. For stroke-specific medication for patients with an ischemic stroke, tissue plasminogen activator is recommended at the goal of fewer than 2 hours upon arrival to the emergency department. Emergency services should notify the pending hospital of possible stroke patient arrival to prepare the system. The guidelines also recommend employees to be trained by creating stroke programs while emphasizing the need for stroke teams that includes physicians, nurses, laboratory radiology, and etc. Quality improvement programs help maintain and enhance staffing personnel education to enhance stroke assessment abilities. Telemedicine should also be offered, allowing expert image readers to quickly identify the need for TPA treatment. Alteplase should be administered following thorough examination by experts. Surgical interventions may also be needed, such as the need for non-invasive cerebral thorough imaging and thrombectomy. Protocols for transferring patients throughout the continuum of care should be in place. Participating in stroke data accessibility is also recommended to enhance patient outcomes while debriefing on areas of improvement. Improvement projects should also be in place to manage quality indicators. Brain imaging and other improvement projects should be available. They are recommended to identify the potential cause of stroke. Blood pressure managed, blood glucose management, along with oxygen therapy, temperature regulation is essential to the management of patients with an acute stroke. Deep vein thrombosis prophylactic treatment with antiplatelet therapy and anticoagulation therapy. Dysphagia, nutrition, and depression screening are also recommended in conjunction with rehabilitation with physical and occupational therapy, according to the American Heart Association. The population demographics are varying groups of whites, blacks, Hispanics, geriatrics, middle-aged, and young adults. The community health partners include Hollywood Presbyterian Medical Center, Virgil Rehabilitation Homes and Skilled Nursing Facilities, varying skilled nursing facility options, acute rehab facilities, hospice facilities, and assisted living facilities. The model of care management is Kaiser Permanente includes independent closed system, healthcare plan, physician medical group, and a hospital plan. The integrated care model includes transitional care model as well. Resources available include cares across the continuum for patients' needs. Patient care-centered approach focused on quality and safe patient care. Key stakeholders include the medical leaders, clinicians, allied health professionals, and patients.